I have decided that the global monkeypox outbreak represents a public health emergency of international concern. Although I'm declaring a public health emergency of international concern, for the moment, this is an outbreak that's concentrated among men who have sex with men, especially those with multiple sexual partners. Stigma and discrimination can be as dangerous as any virus. But with the tools we have right now, we can stop transmission and bring this outbreak under control.
This is Dan Dix here reporting for Press for Truth with breaking news. The World Health Organization has just declared monkeypox to be a global health emergency. This is the highest alarm it can possibly sound because of its extraordinary spread to more than 70 countries. Now, what I would say is extraordinary here is the idea that the World Health Organization could call this a global health emergency when there has literally been 0 deaths outside of Africa. Ladies and gentlemen, let me repeat that, 0 deaths outside of Africa. It's like I said here on Twitter, with 0 deaths outside of Africa, how can the WHO declare monkeypox to be a global health emergency? Do people really think that they can be trusted anymore? I mean, here it is, 5 deaths in total right now, ladies and gentlemen. And as we see here, those 5 deaths have been reported in African nations. Yet, here it is from the horse's mouth, Dr. Tedros, in light of the evolving monkeypox outbreak with over 16,000 reported cases from 75 countries and territories, I reconvened the emergency committee, and based on International Health Organization's criteria, I decided to declare this outbreak a public health emergency of international concern. He says the monkeypox outbreak has spread around the world rapidly through new modes of transmission, about which we understand too little. And here's my set of recommendations for the countries, and we'll look at that a little bit later. But here, for the moment, this monkeypox outbreak is concentrated among men who have sex with men, especially those with multiple sexual partners. That means that this is an outbreak that can be stopped with the right strategies in the right groups. Now, this has brought about a lot of controversy, this idea that this is happening within the gay community and men who have sex with men. And I just want to briefly address this terminology, okay? This is coming from the New England Journal of Medicine, and as you see here, it says, to date, the current spread has disproportionately affected men who are gay or bisexual and other men who have sex with men. And it's like, wait a minute, okay, so you have a category here that says this is going to affect gay men or bisexual men and other men who have sex with men. It's like, wait a minute, I thought men who have sex with men are gay. But here's the crazy part about all of this, guys. In this insanely crazy world of this transgender agenda and transgenderism and transgender ideology seeping its way into society, this is what it's all about. Now, let me tell you a quick little story. I was talking to this kid once. He was telling me about his high school experience, you know, saying he had a pretty good time in high school. He had not a lot of friends, but the ones he had were pretty close. He had a girlfriend. He said, you know, she was great. He was with her a couple of years. They enjoyed the same music. They liked the same events. It was, you know, it was great. She had great hair. She had a penis. She wore really good clothes, had great fashion sense. And I was like, what, hang on. What was that last part you just said there? And rather than kind of hone in on that, I wanted to figure out if this kid was gay or not, essentially. And in not so many words, I asked him that, and he said, no, I'm not gay. He's like, I don't have a problem with anybody who is, you know, that's fine. People can do what they want, but no, I'm not gay. So I'm like, oh, okay. So you had sexual relations with your girlfriend in high school? He's like, yeah, of course. We were together a couple of years. And it's like, interesting. So that's where this is coming from. This idea that it might be happening with gay people, might be bisexual, or just men who have sex with men. That's where this terminology comes from. It's this insane transgender ideology, which is just mind-boggling that we're here at a point. But anyways, I'm getting a little off track. The point today is, ladies and gentlemen, move over, COVID-19 84. Monkeypox is the new fear factor in town. I put that out on May 19th, 2022, and I followed it up the very next day with this one. March 2021 monkeypox exercise predicts 3 billion cases with 270 million dead. As the WHO calls for emergency meeting, they are telling us exactly what they're going to do and what's going to happen. So we're going to talk about all of that in this video and much more, guys. But before we do, I'd ask that you check me out here at subscribestar.com/pressfortruth. This is like a Patreon alternative, since I have been kicked off of Patreon. As you can see here, they say my page is under review as they're currently reviewing it. No, that just means I'm out. I've been kicked out, and they're not going to allow me back in. I had over 300 people here contributing on a monthly reoccurring contribution basis, and so far only about 94 of you have migrated on over to Subscribestar. So I'm hoping we can get that number up today, guys. If you do appreciate my efforts to bring you this information, please check the links in the description below on whatever platform you happen to be watching this video on. All right, let's jump right into it. The World Health Organization has just declared monkeypox outbreak to be a global health emergency, the highest alarm it can sound following an extraordinary spread to more than 70 countries. WHO Director Tedros made the decision to issue the declaration despite a lack of consensus amongst experts serving on the UN Health Agency's Emergency Committee. It was the first time a chief of the UN Health Agency has ever taken such an action. So what is the point of having an advisory committee and a panel who voted, by the way, 9-6 against declaring this as a global health emergency, only for him to say, you know what, I'm sorry I asked. That wasn't the right answer. Just never mind, guys. Forget I said anything. I'm just going to go ahead and do what I was going to do anyways and declare this a global health emergency. I mean, this is just insane. But here we are. We have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little, and which meets the criteria in the international health regulations. Says it hasn't been easy or straightforward. There are divergent views among the members of the committee, yet he still went ahead and just declared it what it is, because here, the health agency's declaration could spur further investment in treating the once rare disease and also worsen the scramble for scarce vaccines. And we know that this is what's coming down the pike as people's fears of COVID-19-84 is waning, and they're realizing that the vaccines are doing nothing because people like quadruple vax Biden, for example, are still contracting the virus. So the move has to, as I said here, shift the fear state from COVID to monkeypox. And that's precisely what they're doing now. As you see here, the WHO previously declared emergencies for public health crises, such as COVID-19-84, the 2014 Ebola outbreak, Zika virus, and I've covered all of these things, guys. And interestingly enough, with this 2014 Ebola outbreak, as you see here, I put this one out in 2014, Ebola fear-mongering, and I said, problem, Ebola virus. The reaction? My symptoms could be Ebola, so do something about this for me. Solution, vaccines, government control, and military intervention. And interestingly enough, guys, if you actually watch that and you switch out the word Ebola for COVID-19-84, I think you may be pleasantly surprised. So if you haven't seen that one, it's like almost 9 years old. Go check it out. I'll put a link in the description below. But here's the crazy part about all of this, guys. This is a report that was put out in November of 2021 titled Strengthening Global Systems to Prevent and Respond to High Consequence Biological Threats, right? And this is an exercise, a scenario that was imagined. As we see here, here's a summary. This was a fictional exercise, a scenario portraying a deadly global pandemic involving an unusual strain of monkeypox that ends up resulting in more than 3 billion cases and 270 million fatalities worldwide. So in this fictional scenario, and may I remind you about Event 201, which predicted COVID-19-84 to a T, and then a few months later it all started coming out exactly as that report outlined. Well, now we have this new report, and it has suggestions for how to deal with this 3 billion case, 270 million fatality situation. And here's the report's findings and recommendations. And interestingly enough, as we go back to the horse's mouth, and he says here is my sets of recommendations for the countries. This was only posted a couple of hours ago. And here it is, his recommendations to everyone. And just look how similar all of this is. Temporary recommendations issued by the WHO. Activate or establish health and multi-sectoral coordination mechanisms, for example. And we go back to, what do they have? We have gaps in national level preparedness. We have to bolster international systems for risk assessment, warnings, and investigation of outbreaks. Pretty similar. Plan for and implement interventions to avoid the stigmatization and discrimination of individuals. Establish and intensify epidemiological disease surveillance, including access to reliable, affordable, and accurate diagnostic tests. And we see things here. Develop and institute national level triggers for early proactive pandemic response. Establish an international entity dedicated to reducing emergency biological risks associated with rapid technology advances. Are you guys seeing these similarities? So it's like, the World Health Organization is just taking a cue directly from this report by NTI. As we see here in March, NTI partnered with the Munich Security Conference to conduct this tabletop exercise on reducing high-consequence biological threats. So it's important that we look at these drills, these exercises, these scenarios, because as I said, we followed that before, and it all came to a T, and now it looks like they're pulling the trigger here on this, the idea that it's time to shift focuses from COVID to monkeypox. But this is where we need to shift our focus as well, ladies and gentlemen, is to, first of all, turn that TV off, turn those radios off, crumple up those newspapers that are just pumping you with propaganda and fear, and really just continuing to perpetually keep this thing going. That's how it works. But what we need to be focusing on, rather than all those distractions, is how to become self-sustainable in our own lives, not relying on the government or the banks or even the grocery stores moving forward. And this is one of the things I've been personally focusing on the most in my life. I don't have this just yet. I'm working on it. I can't wait until I have this. But this is one of the most important things that I'm working on outside of Press for Truth, to make this a reality for myself. And I really hope that you guys are working on a similar thing. Because at this stage in the game, we can't be looking to the government to solve the problems that are created by the government. We can't be looking to the banks to, bail us out of this fiat debt-based system that we're all born into. What we have to do is take the responsibility amongst ourselves to live the life that we want to live. And the only way to do that right now, moving forward, is to work towards having yourself a self-sustainable garden, so you don't have to rely on getting your food from the grocery stores, and you don't have to rely on money from the banks, and you don't have to rely on support from the government. This is the one true thing that they fear the most, is an independent, strong individual who is capable of providing for himself and is not looking to the nanny state to do that for him. So I just want to encourage you guys to, like I said, if you're not actively working towards this, you're 2 steps behind right now, and just wanted to put that out there. So that here it is, guys. They just declared it to be a global health emergency. I tried to warn about this coming a couple of months ago, but here we are. Nonetheless, the focus now is to get yourself onto that self-sustainable lifestyle. Before this gets, before that becomes pretty much impossible. I want to remind you guys to check me out at subscribestar.com/pressfortruth. Once again, if you do appreciate my efforts to bring you this information, I have been kicked off Patreon, so if you do appreciate my efforts and you want to help, supplement that source of income that was taken away from me at the blink of an eye, at the snap of a finger, you can do so by checking out the links in the description below. As I said, depending on whatever platform you happen to be watching this on, whether it's on BitChute or Odyssey or Minds or Float or Rumble or, Bastion or Hive or maybe even YouTube, wherever you happen to be watching this video, check the links in the description below to find out how you can support my efforts, and to where you can do your due diligence into all the sources for this video. that I posted here today. So that's all for it today, my friends. I want to thank you so much for joining me once again. Don't forget to click that thumbs up button, share this video, and stay tuned. We're going to have more video reports coming soon. This is Dan Dix reporting for Press for Truth. We all want truth. The truth will set you free.